Okay, would you join me in the pledge? I
pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all.
Well,
If you ever want to go, I pledge my head.
I would like to start off with Derek. Derek's got a scoop, but Derek talked to us at our last study session about finalizing the bid for the northern ambulance service, which would be special service area number 2. And I'm skipping over public comment so that after he's given his report, we've talked about it. I understand you're here if you wish to make it. You don't want to say anything? Okay, but we'll still wait. So Derek, take her away, buddy. Thank you for your help.
So, I think everybody but Carl was here the last time through. So only minor changes were made. We had one final meeting of the committee. We put in our revisions, and this is the final product. So, if you guys are on board, we'll pass it forward to the county board meeting on Wednesday. Please look through it and let me know if you see anything glaring. I'm sure I probably missed something in there as far as just wording or whatever, anything you find that's unclear. What I did, or what is new since last you saw this, was just added some highlighting for emphasis, tried to clarify some issues. For example, under qualifications, line 1 there, just eliminating that it's one of the 2 criteria must be met, not both or just one. Also highlighted the shalls, and therefore kind of pointed out the shoulds as well. Those are the highlights, but certainly any questions or concerns you have, I'm here to answer. Go.
Is it true they will not get any tax money for a year? So they have to have enough money up front to start the business?
Yeah.
That's what somebody said, I just wondered.
Well, I mean,
So you already levied a tax for them? or
yeah,
something?
you voted on it.
Okay, all right, that's fine.
What's the total amount of the tax levy?
$254. Now, they won't get that much after, we never collect 100%, so
Right.
it'll be somewhat less than that, and we need to acknowledge that in the, I'm not looking at you because you gotta come up with the contract, but we need to acknowledge that they may say that we want 254 in the contract. We may have to allow that once, things are subtracted from it in non-collection, it may be 98% of the 254 or 96%, okay? So that's what they can count on.
So what happens if they bid 300, we can do it for 300,000?
They'll be sorely disappointed. I mean,
what,
as far as
do you feel like based on what you got, the qualifications and all that stuff, that they can operate for 254,000? Or,
yeah, I mean, so
is that reasonable? You see what I'm saying?
I'm following you. So, the responsibility for that via the bid spec, I would question whether that's actually the case, whether that's the responsibility of going out on the bid spec. That's on the contractor to decide whether or not they can swing it, right? That information is public record. If I called you, Augie, and said, or you would turn me to the treasurer and tell me exactly what I could expect, or within plus or minus $5,000 what I could expect, right? So that information's out there. I would say that the way this is structured, the min requirements are literally the minimum outside of somebody throwing you in the back of their pickup truck.
Right.
So, and I don't mean to be facetious, but it is the lower level service, the BLS service, which
Compared to what we,
yeah,
what
it's
we did the
not
last contract.
paramedic. The number of ambulances is basically the bare minimum.
Right.
As a county board member, I would want in place to have coverage, to not have to, be extra flexible as far as what coverage is in place.
Yeah.
So I mean, all of that, when we put this together, you can expect that, or you should expect that I didn't do this from scratch, right? It was a lot of what we did before.
Right.
Plug and play with new information, and trying to, same as last time, cast as broad a net as possible, right? We wanted the maximum number of bidders, things of that nature. So that's kinda how it was put together.
That group up there, they feel comfortable with the, you know, the bare minimum, so to speak.
Can you be more specific? You mean just the people that live in the 6 townships?
Yeah, you know, compared to what they've got now, I mean, do they feel like, you know, just having one ambulance and I think, is it manned 24/7? Is that?
I mean, Adam, can you tell me more about that? I mean, as far as exactly what's in place right now, I can give you my best
Well,
guess.
I mean, what are we, I haven't, this is the first I've seen it.
24/7/1.
Okay, see, I didn't,
the-
You're asking
in the
what's in the
bid.
bid spec.
yeah, I haven't seen
sorry.
this, so I don't know what's in here.
So, 2 ambulances, one crew 24/7, BLS service is the basics of it.
Right, okay.
And remember, you have two people from 2 of the 6 townships on, 3 on the committee of the 6 townships that are on it, that developed this,
Yeah,
okay?
and they're comfortable with, yeah,
I assume so.
So,
I talked to Mike this morning, he
yeah.
was, Lisa's here, she can tell you.
Right.
That's how it came up with the qualifications being 2 different ones.
well, yeah, so where we started from was some of the potential bidders from up north. And just basically the committee in general said, we think it is more reasonable to have a BLS level service that's a little bit cheaper, a little more affordable.
Right.
You know, again, broadest net possible is where that comes from. So, I think currently, I mean, the Chrisman service is a BLS service, correct? That has paramedics that are,
Technically, they're BLS with the option to field upgrade if they have advanced providers available.
got all that?
Can you make that English?
So they staff most of the time a BLS ambulance. They have 2 of their employees are paramedics, so if those paramedics are available, they can do what the state calls a field upgrade, where they can then operate, once the paramedic's on the truck, they can then operate that as an ALS ambulance,
Which
But-
is the highest,
which is the more, without getting into the weeds, yes.
okay.
And the equipment on that ambulance is such that they have the same equipment that an ALS full-time or actually,
I can't speak to that, I don't know enough about what they do up there to answer that.
but an ALS ambulance technically has more equipment than a BLS ambulance.
Correct.
Okay.
so with this process, you know, they do the bids and then the county board is gonna be responsible to come up with a contract similar to, or like we did with the Paris, on the Paris contract.
Right.
And then we can, you know, if they're not living up to the contract, that'll be addressed and all that kind of like the same process we went through.
And that would be in the contract language.
Right,
I would say, one thing to note is, between those 2 points is, you know, obviously, if there's something that comes up between when you award a bidder and when you write the contract, as long as the winning bidder is in agreement, you can go beyond what was in the spec.
Right.
But if they're not, you can't.
Right.
So, I mean, that's an important thing.
so I
to
guess,
stop on.
is there enough in here to make sure that we can, when we go to write the contract, you know,
Yeah, I'm with you. I would say, you know, this is basically the same bid spec we
Is
used
it?
before.
is it,
You know,
okay,
I didn't make large cuts, I didn't
Right.
have large additions.
okay,
And in fact, outside of the qualifications line, it is, anything that was added was a should, and not a shall. So,
yeah, okay.
I think you gotta, you know.
Yeah, I guess another question I have on there's something about 4 or 5 mile from the intersection.
Mhm.
So if they wanna set up Scotland,
Mhm.
they can.
They can put it in Terre Haute, and if you decide to award them the bid, then so be it. Right? That's a should. So some of this goes back, you know, I'm not on this county board thing, you know, it's for you guys to decide,
Right.
right? So what this says is, hey, it should be there, but if you get 3 people bidding and one is the outstanding bid by far, or that has the lowest bid, most responsible, all the language in the bid spec, and they are 6 miles out or 8 miles out, that's on you to decide. That's, again, why we wrote the spec the way we did.
Casting the largest net.
Do you have any idea how many runs they make a month up there? Any idea?
Less than 1.5.
So
A day.
it comes
A
out
day.
to, it comes out to about 1,000 a year, roughly.
Oh, really? Even
3.
recently, since the, a lot of the stuff from the, nursing home is going north?
That's what I was asking.
Oh, I'm just talking, that's what they run, where they take it is up to
Oh,
them, but I'm saying as far as what they're running right now, is they're doing about 1,000 a year.
So it's about 3 per day then? Or less than 3, 2.5.
2.5,
Mm.
and a lot of that does come out of the nursing home up there.
A lot of them don't come here, all right. I heard
I won't,
heard that
I
was
won't,
in
again, I
Northern
won't dive,
County.
I won't dive into the weeds on that one.
Very
Dan.
seldom see.
Doesn't matter.
Another.
So the Crispin ambulance is making 2.5 runs a day? Is that what you're saying?
Well, they pull out of the garage and do something 2.5 times a day. I guess you call that a run. You know, when I think run, I'm thinking I'm gonna run that patient somewhere.
Right, not
A
necessarily.
revenue
Right.
generating call, you're between, let's just call it between 750 and 1,000. I mean, I know that's a
Yeah.
wide range, but
And do the fire departments go on calls like they do down here, up there?
they, Crispin, Hume, and Metcalf all have first responders, so
So, and they respond to all ambulance calls?
I won't say all, but I'd say.
Majority of them?
Majority.
Okay.
They don't respond to nursing home calls, but anything else outside of that, they normally do.
Okay. And then they don't have, I guess, if they are required to have 2 ambulances, are they gonna have people, plan to have people on call for backup?
That
In
would
case-
be entirely over to the contractor. They will put on their bid whatever they're gonna have available. I would expect, much like it is now, they are staffed, ready to run 24/7 for one.
Okay,
Second
so
one
when that-
can be called out, I mean, they have people that are just
Yeah,
like,
I guess my question is, like, if they're they're going to Champaign and they get another call, what do? Do they have their backup, people on call to man the other one, or are they gonna call Paris and say, Paris, you come up here?
depends. Most likely, there's probably somebody to be on that ambulance. But, again, you are currently in a unique situation where your provider is staffing and providing equipment beyond what is the scope of the contract. I wouldn't be in the habit of expecting that every time you sign a contract. You with me?
No.
Horizon Health has provided more services than they were contractually obligated to
Right.
do. So when,
I agree, but I guess my question, should we want them to provide more?
you, the
but-
board, can decide, I mean,
Well,
so
that's my question,
you're,
Yeah.
go ahead, Jeff.
You have negotiated and talked to a lot of them.
Yeah.
And
a lot
based-
do.
This wasn't done in a vacuum, much like last time, right? I'm talking to people that have an interest, so I know generally the players.
People that are interested in bidding?
Yes.
Okay.
And for the money, we're casting the largest net we can and giving them the options on how they're gonna bid it.
So let me
Then
position
we
it
need
this
to
way,
decide whether we want this or that.
Or we want something better?
So understand that this is a different service area.
Right, I
Right,
understand. Yeah,
so
I
a
totally-
much less desirable from an income standpoint.
Right.
Exactly.
So
I understand.
when you are trying to get someone to bid on it, you don't wanna put so many strictures in the way that you preclude someone from bidding. So that is how I went about this.
Okay.
And so I understand that may cause problems for a board trying to establish this service and develop a contract.
Mhm.
However, I want you to have that problem in the first place and have people bidding for it. So
Right.
that's why I
Right.
structured this, or why the
Okay.
committee structured it the way they did.
I'm trying to understand.
Sure, no, I'm with you.
That makes sense to me, yeah. You could rule a lot of people out in a hurry, but.
Yeah, I mean, I don't think,
Stringent
there's
things
not
like
gonna
that.
be a line around the block for this one, so,
Right.
you know, that's part of it.
Yeah, okay.
We can continue with questions if you think of any on Wednesday. It is on
Okay.
the agenda to authorize the bid to be advertised and be due on 4 o'clock the 5th of April. So that we have about a week to take a look at it before we ultimately award it. I remember last time, I think we had a special meeting to consider it a little longer. At that point, it's up to us. We might ask opinion, okay?
Got lots of those.
I
So you do
won't take that
have,
any further.
so you do have interest,
Huh?
so you do have people interested in
Yes.
doing this. Okay, good. That's wonderful.
Well,
As far as we
think-
know, right? I mean, that can change, I mean, you know,
We've had somebody that was interested, then somebody, or then they weren't. They may change their mind back again. You
So
never know.
if nobody interested, we're in trouble.
what's that?
If
Well, yeah.
nobody interested, we're in trouble.
It changes things. So, you know, this is the first step, and frankly, we may put something out there, and we have to be ready for the possibility that no one bids.
Right.
At which point, we're back to the drawing board.
Right.
So fire your committee chair and find somebody that can do their job right, I guess.
You,
Yeah, well, no, fire me.
No chance.
Are there other questions?
nobody wants the job.
Those are the ones I take.
I know you said you didn't want to speak. Do you have a question?
After I went on and on, you might have some.
Well, no, just, are you done discussing the ambulance
Yes.
after this? Okay, so
Yes.
then I can,
You can boogie, but you're
Oh, it's
also
pretty
welcome
entertaining.
to stay. Okay?
So she got, basically wants to hear the ambulance.
Yes.
Just,
Okay.
I have
Just
some
ex-
share meetings, so.
do you need the digital copy, Augie? Can I send that to you, or is it, what can I do to help as far as?
Send a digital copy.
You also need to possibly send him a name and possible bidders and their addresses if you have them.
Okay.
So we're not waiting for them.
Sure.
We're trying to encourage them to bid. We wanna make it as, does that make sense?
Taking, correspondence at the home office.
Anything else?
No, my husband.
Okay, we'll move on to the
Is he?
ambulance service then,
Okay.
the report
And you guys have your monthly report in front of you.
somewhere.
Here's it right there, guys. So for February, we're sitting at 140 for the 911, it's just a hair lower than last year. For an average of 5 a day. When you factor in the transfers, we were pretty much on par
Thank you, man.
with last year. As far as our times, still well under contractuals. Our dispatch and route averaged at .63, so considerably better than January. So that is something we're trying to get better at, is decreasing all our times. We can only do that to a certain point on some of these, but say .63 is actually really good. You see transfers, emergent versus non-emergent there. We had 2 fire standbys, 36 were our treated, not transported, so either we went there, did lift assist, or they just decided they didn't want to go to the hospital once we got there. 6 free rides, we did 8 community health visits. That is considerably lower than the January numbers. That is due to the COVID numbers are decreasing, so we're not seeing as many, not doing as many COVID visits, but we're starting to pick up some of the chronic illness patients, whether it be CHF, COPD, diabetics. We're starting to do more of those visits, so I'm hoping that program takes an uptick. 3 intercepts or mutual aids, whether that be us going up to Crispin, or lately we've actually been going down to Marshall at least once, if not twice a week. So. We're still not seeing any PR events due to COVID restrictions. Then on the second page, you'll see all the percentages of where we transported to. So again, Paris is the main one, but we are attempting to accommodate patient requests when available. The past couple weeks have been extremely taxing. Had 2 trucks involved in incidents. I'm happy to say those trucks are all now back in service. We're still waiting on some of the vinyl work to be repaired on Medic 2, but it is fully operational again. You guys probably heard there was a terrible incident Monday of fatalities in a structure fire, along with another patient severely burned. My crew's on that. Anytime kids are involved, especially something as terrific or horrendous, terrible as that, there have been some mental health issues. I've had to give some crew members some time off to deal with that. We're actually we had one debrief the day after the fire. We're having a follow-up tomorrow, just to kind of keep everyone's mental health in check and make sure everyone's doing as well as they can. So that night, I sent 2 trucks out to that fire. There ended up being the 2 fatalities. One truck stayed on scene to do rehab and assist with the fatalities. The other truck there were 3 patients. So the problem with that is my crews did the best job they possibly could. I'm super proud of them. But one truck should not have to transport 3 patients. We requested assistance from one of the Terre Haute ambulances that never showed up.
Never showed up.
Never showed up. There was apparently a breakdown in communication on their end. I've done a lot of follow-up. Our dispatch did what they're supposed to, but Vigo County, whether it was Vigo County Dispatch or Transcare, really dropped the ball. So I'm working on fixing that. But this leads me into this. We've never had this issue since we've taken over, but on incidents like this, I would have sent all 3 ambulances. I was actually I had my son for the weekend, so I was not available. But in an instance like this, it is possible I will send all 3 ambulances to a call, have all the ambulances tied up. We're contracted to have 2 available for 911. But in that instance, I'm hoping you're all okay. If something that bad happens, you all understand that I may have to send all ambulances to a single incident and rely on mutual aid if more come in.
Why didn't Transcare show up?
I don't know.
They'd been on last time we had
I've been talking to their operational manager, and I'm not happy with that situation, but I can't do anything about it now.
I'd say we're pretty satisfied with what you do. I mean, if this is your judgment, you know more about this than we do. If you think that's necessary, I don't think you have to defend it.
No.
So good?
Not to me, you know.
No.
So I just wanted to bring up that topic, that there may be, if an instance like this happens in the future, I hope you all trust my judgment on what I need to do, and I'm obviously keeping the best interest of everyone in mind, but in that case, I wish we could have done a little more, but we did the best we could with what the situation we presented with. So.
Did you guys transport, or was a helicopter involved?
So we requested helicopter. Apparently the visibility was down that night, so helicopters were not flying.
Okay.
There was one pediatric patient that was badly burned, an adult patient had burns, and another pediatric patient that had minor burns. But again, one truck was dedicated on scene with the goings on there, because we did have some firefighters that inhaled some smokes who were doing rehab on scene, along with the fatalities. And one truck stayed in town to cover other calls. And nothing against them. They were under the impression that we've got this contract uphold, so we have to have a truck available. I'm like, I'll take care of the county board side. You guys do what you need to do, but that's where I need you guys is trust me to do what I feel is the best judgment.
Yeah.
So
Well, I think you got our support.
I appreciate that. Anybody have any other questions about the report or otherwise?
Turn the sound down on the siren.
I've got a work order in. It's on the docket.
You still have that covert ambulance receiving around.
Yeah. So yeah, we were running that for about a month between the 2 ambulances down, but like I said, we're luckily have our 3 main lines back in service. That one's actually running up to Hume today. Our mechanic is up in Hume, so it's just up getting oil change, but it's out and about today.
Thank you, Evan.
You guys have any other questions for me? If not, I'm gonna leave.
Thank you.
Thank you, guys.
We're gonna start backwards. Augie, do you have anything?
I don't think so.
How's voting going?
Slow.
I think since we started on February the 25th, as of Friday, we had 14 voters.
What are you voting
Now, I was gonna ask, what are we voting on?
Townships,
No, not
school
little
boards.
papers. So
on?
forth.
School board.
Yeah.
I don't even know them anymore.
Well,
Yeah.
if we ask that way, maybe the newspaper will say, hey, you can vote. So at any rate,
We've been
the-
running ads in the paper, so that it's in there.
When's the election?
April 6th.
round the
So when
corner.
did you start voting?
February 25th,
Right before
Early
the
voting.
election,
So like a
yeah. Is
month
it
and a half,
Free elections? The school
40
board?
days out.
40
School board
days.
is in-
Yeah, school board, yes.
I saw, I didn't read the article, but
School
I,
board of the city, I think, isn't
Hmm.
it?
I'm sorry, I started that. Go ahead, Carl.
I saw that the president signed an executive order on voting rights and stuff like that, that they're making it more liberal to
Easier
do
to
things
cheat.
a whole lot easier, and I think we're headed down the wrong way.
Easier
Yeah.
to cheat, Carl, is that what you're
That's,
saying?
yes,
You could just say that.
yeah.
Well, as I reported for the presidential election, as far as vote by mail ballots, you have to request a ballot. So you call us and you want to vote by mail, we send you an application, which is only the request. So we want a written request. You send that back into us. Then we send you your vote by mail materials, which has another application in it and a certification envelope. So I think that's probably as controlled as we can make that.
And what's, I guess, and then is it still 40 days out before you can make that request? Or is it 60 days, 90 days?
Oh, gosh, Carl. Yeah, it's prior to the 40 days,
Okay,
where you can give me a request anytime you want. It's just, I can't mail you your ballot
mhm,
until that 40 days prior, because that's when we start early voting.
okay.
I've taken them 3 months, the request, hey, put me on the list.
Well, I just see a problem, if it's 60 days before the election, something could happen in that 60 days, and, people already voted, and they, it's too late, I just
It
think
is.
it's too early, and I just think we need to go back to more in-person stuff. That's just my
So-
personal opinion.
So most Republicans, Democrats don't agree.
Yeah, the remedy
I
is to
agree.
contact our
You're
state
communist. I don't know what
representative
you
and senators.
Yeah. Just the federal, they need to keep their nose out of it.
I don't disagree with anything you say, Carl.
Thank you, Lucky. Well, Dan, you have anything to tell us?
Well, if I have something, you're gonna get angry, so, but it has to do with the vaccine. I talked to Janet the other day, and most of the vaccine that we get is coming from the state, and most of that stays up north, so we're not getting what we should. Plus, they're starting to give the second shots, and that's probably taking at least half the vaccine that we're getting. So Carl, you may have signed up, or I don't know what your age is, but we're down probably to the maybe mid-70s, low 70s right now on the age limit, so that's one reason why you're probably not getting a call. You also could go to Kroger's and Walmart and make an appointment, and they do have vaccine because most of that's coming from the federal government, not from the state. So I know our health department's taking a lot of flack because we don't have a vaccine. Also, we're now getting the second shots. I get my second shot this week. So maybe half the vaccine that comes in to Edgar County is going for second shots also. So I know you're getting a lot of flack, I'm getting a lot of flack, health department's getting a lot of flack, but I think they're doing a great job and doing the best job they can do.
The situation is they have been getting, even weeks when they say they're not getting any vaccine,
Correct,
they're still getting the second shot vaccine.
right.
So last week they got 250 in, plus the second shot. And they were able to do those all, I believe, on Wednesday.
Mhm.
And then they also had a second shot drive-through. So they're starting to get a little bit more.
Mhm.
And of course, with the Johnson & Johnson talking to Janet, that may help improve the
Right.
situation. You are right, the 2 or 3 different private entities have contracts with the federal government. And there's a big pile out in Washington, picture. Part of it goes out to these contracts and part of it goes out to the states. So there's a bifurcation. You like that?
That's good. Toilet paper?
I
Yeah.
got a two-part
Yeah, look at
buy.
that.
At any rate, bifurcation there,
Right.
it is causing, we did get, we have gotten comments, which I passed along to Ollie and Janet. Not a lot of people, but a few people have complained
Mhm.
vigorously.
Right.
Of course, I hear it all the
I do
time,
too.
wherever I
Where
go.
Right.
And we had a call from the state of Illinois, a conference call that Monica and I were both on. And they were under the impression, which we challenged, and other people from smaller counties challenged, that, well, we send it to you and you don't get it used. Well, that's just straight out BS, okay? And we asked them, who's giving you that information? Well, they fumbled around and they're just doing what they wanna do, so.
Gee, there's a surprise.
Yeah, you have only 28 days between your first shot and your second shot. So when you get the vaccine, then I gotta have my second shot by March 11th, which is this week.
Mhm.
So-
I get to give it to you,
And the
well, then
vac-
special.
Get too big at night, but,
Need a bigger syringe.
no, it's just,
It is
they're
frustrating,
taking
but
a
it
lot of
is,
flack, but they're doing a great job.
I think the health
Well,
department
if
is doing.
if they haven't got it, they can't give it. But people don't really know that, I don't think.
And
I think
sometimes-
one of the more important things is they need to make sure that people take the time to understand, and I know they're getting a lot of calls.
Mhm.
The communication of where we're at is important too,
Right.
and, so, that's just
No,
my
Janet
thoughts.
said the other day, they had like 3 or 4 doses left at the end of the day because people had not shown up. So they actually called people again to come in and get their shots, so. They're not gonna throw it away, I guarantee you that, so.
Well, that's, for example, my second shot came after I was supposed to be last Friday, and they called me in because several people had not shown
Right,
up.
Right,
So I got mine a day early,
right.
so, and then they were able to call somebody in to get my shot, so, the next day, so.
But if you wanna get yours, you might try Walmart and Marshall. To set
That's
up
where I
an
went.
appointment.
Very, very
Or,
simple.
somebody said Robinson, you call down there, Kroger's is also giving shots.
Hmm.
I don't think you can go out of the state
I
though.
really like
That's-
that.
that's the-
Walmart Marshall, that's the best deal.
Anyway, it's very frustrating.
Yes, it is,
Communication is still key.
right.
We need to communicate the best we can, the health department does, the hospital. We all need to make sure that we're communicating.
Right.
So is the health department doing their shots at Lake Ridge now versus the hospital?
They're giving the second shots at the drive-through at Lake Ridge, that's where I go.
Yeah,
I think, and also they gave first shots last week at Lake Ridge. But they, when they call you, they will tell you where to go get your shot,
I got my second shot right at the health department.
yeah.
okay. Well, I know I've heard a lot of complaints about the hospital
The
because
hospital had
of the
nothing to do with
parking. I mean,
it. Yeah,
I know a 90-year-old guy
Yeah,
that took him 15 minutes to get, because he had to park
right,
and to get in and then they finally, when he got up there, they got a wheelchair, and I've just heard numerous complaints about the
It's
hospital, so
really bad.
they need to maybe do at Lake Ridge or, you
Well,
know,
hospital.
KC Hall.
They're not giving
Hospital
They're not
not giving
hosting,
shots.
I don't think they're hosting the
Right.
shots.
Right,
They're not giving the shots at all, but I don't think they're hosting it.
no,
Yeah, the parking is a big challenge there.
Right.
And they do have, if you call this one number, they will come out and help you with the
Yeah.
wheelchair and all that, but everybody understanding that is tough.
Well, yeah, a 90-year-old person, I mean,
Right.
they just need to stay away from the hospital because of that situation. The health department needs to do it somewhere else.
no,
Yeah,
there
that's
is
what
a
they're-
way,
Well, hopefully
there is a way you can go in on the west side and drop the patient off. It's kinda hard to get back out.
It's,
you
it's
pick up-
not a real user-friendly
You
situation.
pick your meds
No,
up
it's
that way.
definitely-
as far
So
as-
they're not using the hospital anymore? Good.
No, no,
I knew that wasn't gonna work, when
No.
hard they were doing
Ollie did have a letter kind of to the public.
it.
But I know, I'm just saying
Yeah.
that, I mean, they did apologize.
But not everybody gets the paper
I
too,
understand.
you know, that's,
I'm just saying they're making an effort.
right.
I just think if you hear complaints about the health department, you should not listen to them, because they're doing the
Well-
best job they can do.
They need to make sure that somebody's there to answer the phone.
Right, I agree.
And
with you.
That's a
communicate,
big
that's what I'm
problem.
talking.
Right,
Yeah, because those are that's the feedback I'm
I
getting.
think
is
they've
that
got,
somebody's not on the phone.
yeah, well, they've done away with a lot of their, how do we call them? People that have been calling and checking on and so forth. We've done away with quite a few of those, because you're not having the positives like you used to have, so.
But there should always be
Oh, yeah,
somebody
there
at the
should be,
phone to pick
right.
up the phone.
Right.
That's
Yes,
really
I
the
agree
only
there.
issue I've had,
Right,
heard.
Yes.
Okay? Thank you, Dan.
you're welcome.
Russ, do you have anything? Carl?
No.
Nope.
No,
Didn't
the
ask you
only
first,
committee
but-
meeting I've done is
Sure,
the
he was
ambulance.
going to.
Okay, a couple things on the bills. Let's see. There were some errors in here and I wanna make you aware of them, in case you look at them later and go, what the, you know. Let's see. Hang on. Okay, buildings and grounds, let's see, I don't know what page it is. 1, 2, 3, looks like page 5, it's got committee 39. Committee code 39. You see, come down to 3197. That is not a bill for the general fund, that is a building, or that is a bill for the courthouse security. And let's see, there's several of them, so I wanna make sure I'm looking at that all right. That's correct. Then you go to the next page, and you've got Gibson Teledata. That is a combination, that's halfway, I'm sorry, Committee 40, and at Gibson Teledata, that belongs to a lot of, it belongs to the courthouse, it belongs to 911, it goes to sheriff. No way is that the administration of the phone system is only to pay phone bills. So I've talked to Ross about both of those bills, and those are gonna be corrected by Wednesday. Then, let's see, the top of the next page, you come down to Kyle Thompson. That is we've got to figure out where that goes, but that isn't on administrative either. So we'll get those corrected. The bills are fine, they're just being not assigned to the correct areas, okay?
What is the Kyle Thompson?
That is the phone system.
No,
No, I'm sorry, what is it?
He's the
Regional Office of
County-
Education.
Oh, that one's fine.
Yeah, I was gonna say,
That
that's,
one's, I'm sorry, that one's fine, I got
Yeah.
carried away.
He's the one that makes us wear a mask at meetings.
Yeah, the county support installment, we need to put in there more description about what that is, because I keep getting confused.
okay.
It looks like, Kyle Thompson, I don't know what Kyle Thompson is, that's the.
Well, we
regional
just patterned it
superintendent.
after Bobby Matting.
She.
Well,
for all
Then
those
she
years.
it needs to
We'll
have,
change it.
right. I'm sorry, that one's fine. And then, under health department, wherever that is,
50.
50, thank you. I gotta go back a sheet. You'll notice that they're reimbursing us out of the $800,000, $25,912. That is correct, that goes to, the unemployment, social security, IMRF, reimburses for all of the the additional staff that they put on for COVID. And that's actually a CARES reimbursement, and that will go back into those three or four funds, okay?
Is that part of the 800,000?
Yes.
Get from the state?
Yes.
Okay.
And there'll be one more check whenever it ends for whatever they use this year.
Okay.
Because our funds can't take that kind of a hit. That's a lot of money
Right,
out of those, okay? And the feds are paying for it, so,
right.
okay? Wind farms, we're gonna have a committee meeting, later on this month, in the first part of April. I think we're close on a resolution. We're gonna check on some data that we were hoping to get and haven't seen in over a month. Does that sound right?
Yep.
So hopefully in May or the first part of June, we'll have a recommendation to modify our current ordinance as we all discussed. What month was that? November? November or December, so. I believe so.
You changing the setback on the new?
Well, we're still talking about it.
Okay.
Some of us have come up and maybe somebody's come down and somebody's in the middle, and I hate agreeing with John, but I may actually have to.
John,
Kidding. I just tease it. So we're close, okay? Let's see. Budget, I hope very shortly to have a Fund 100 status for the end of last year to you. Currently, that budget, we have not received everything, but we have a balance of expenditure, revenue over expenditures of $555,000. So, but a lot of that was due to one payment we got from Ameren and some of the other things. Of course, we spent a lot more money last year in general than the budget because of the jail. So, at any rate, I'll hope to have that out. Our audit starts soon. Everything's lined up. I think they're coming Monday. Hang on,
I think it's next Monday.
22nd is when they were gonna come on the 15th,
That's right.
and now they're gonna come on the 22nd. They've slid it out a little bit. New monies, the federal program that's going through Congress right now that the Senate approved a couple of days ago is gonna go to the House tomorrow for their vote. And there's monies that come from the feds directly to the counties. Cities and municipalities will get it through the state, but counties will get it direct from the feds. I don't know how much it'll be. We still have to qualify. And it has to be COVID related or in some way, shape, or form, but we haven't seen the criteria yet, okay? I just wanted to make you aware of that.
Who will work on that once you find it out?
Josh, he worked on all the CARES and COVID last time. I don't know how the health departments are gonna receive their funds, so I would assume that part of that would also be, going to Janet and her board, okay? Let's see, we did bills, audits, Medicare, we haven't touched Medicare reimbursements, although they've gone up for the last several years. And Billy Ann did a survey of where we needed to be, and so those will take effect next month. So I want to make sure you're aware of that. Lawsuits, if you want to go into a brief closed session, we can do that. I can tell you where a couple of things are. I didn't ask. Augie has asked the last couple of times if Mark wanted to, and he didn't have any ideas that he needed to do that at this point. Policy-wise, we're working on videos in the length of time that we keep them. We had a meeting with the state's attorney and Ross and the judge about what, we have 102 or 106 cameras out there. Do we need to keep some forever? Do we need to keep some for 3 months? Do we need to keep some for a year? We need to decide on that and have a policy that directs how we're gonna do, just like we do on saving, things on the computer. So the 60 terabyte system is, if it's not in, it's almost in. I know we're paying for it. It was $5,100 and it's on to the bills this time. So we're trying to update that. The other thing, they have as a service that will be outside to evaluate the census once it comes in, to do, you know, well, not an arbitrary, but an evaluation of what might work best and make a recommendation or a couple of recommendations to the board on districting. So that's something we could do. I haven't asked them to do that yet. Of course, we don't know how soon. Augie, you were telling me the other day how far out that probably is. What, several months yet?
That'd be my best guess, yes. That's the way it was 10 years ago.
Okay. So,
And so that has to be decided by what, September of 2022?
something
Is
like
that
that.
about right?
Well, in advance of opening petitions, because you gotta know what district or what your boundaries of your district for the county board you're seeking
Well,
election.
that's in November of this year,
No,
December.
okay, let's back up. You said September of 2020
2022?
is what you just said.
I didn't mean to.
Yeah, okay. No, we should know something, well, I'm just going off my memory from 10 years ago. And it was in September when we drew lots for length of terms. We should get the data hopefully sooner rather than later, but again, 10 years ago, it was early summer, and we analyzed it, and I calculated up, and you know, the population for the districts and townships and whatnot, and so I'm expecting it to be very similar this time. So
So everybody's up for election in 2022,
yes,
but you'll be up for different time frames.
yes,
Either a 1 or a 2,
2 or 4.
2 or
2 or 4.
yeah.
Okay.
And the petition filing will begin this September.
And it's due like on December 6th.
So that all has to be decided prior to that.
That's correct.
Mm-hmm. Mm-hmm.
So I just wanted to bring it up because, I mean, we're in March and for all practical purposes in April, so there's not that much time left.
Yep.
The way time flies by. I just want to make sure everybody was aware of what was going on. So. Do we want to have a closed session to talk about anything, or are we okay today? All right, that's fine, that's fine. Anyway, anything else to come before the meeting? Yes, sir.
Have we done anything on, an architect for a new jail?
Sorry.
People keep asking about it, so
I'm
I don't
sorry,
know.
I forgot, yes, I
Okay.
skipped over that. They, first of all, Coles County has hired a planner who will work with our planner and coordinate all the activities. Yes, we have an architect that's,
Okay.
and I announced that at the last meeting
Okay.
to all of you guys. That we, right?
Yep.
All right, we have an architect. They are working on 2 things right now. Number 1 is doing a population study for long-term, and number 2 is doing a study on the old jail to tell us what the condition is for it to be a jail for the future. So that's where we're at on that.
So we may not be building a new jail.
We need to do it right in order to make that. We need to fairly evaluate what we have, site evaluations, if we do need one, you know, all the things that go into it. We need to involve the public so that we would make ourselves, if we are going to either do a renovation or a new structure, what goes into it, what the people think, so that we are eligible for a USDA low-interest loan. Okay, that's 30 or 40% forgivable, rather than going out on our own. Okay? Does that kind of
Mhm.
tell you where we're at? Are there any questions about that? Are there any public comments? Hearing none, I guess I'd entertain a motion to adjourn.
Move.
Phil moves, Russ seconds. All those in favor signify by saying aye.
Aye.
Opposed, nay. We're adjourned.